Η ανθρωπιστική κρίση στη Γάζα είναι οξύτατη, με σοβαρές ελλείψεις σε νερό, φαγητό, ιατρικές προμήθειες και ηλεκτρικό ρεύμα. Εκτός από τους πολυτραυματίες, παιδιά, έγκυες γυναίκες και χρόνιοι πάσχοντες χάνουν κάθε μέρα τη ζωή τους. Συνομίλησα με τον διάσημο καθηγητή Νευροχειρουργικής David Hasan του Πανεπιστημίου Duke στις Ηνωμένες Πολιτείες, ο οποίος συμμετείχε πρόσφατα σε ανθρωπιστικές αποστολές στη Γάζα και σκοπεύει να επιστρέψει εκεί σύντομα. Ο Χασάν είναι διεθνής αυθεντία με πάνω από 270 δημοσιεύσεις και μέλος συντακτικών επιτροπών σε ιατρικές επιθεωρήσεις με τη μεγαλύτερη απήχηση διεθνώς. Γίνονται μεγάλες πορείες σε όλο το δυτικό κόσμο για αυτή την υπόθεση. Κολέγια και πανεπιστήμια στις ΗΠΑ έχουν παραλύσει αυτή τη στιγμή. Πώς πρέπει εμείς να σταθούμε απέναντι σε όλο αυτό, και γιατί είναι ένα πολιτικό ζήτημα που πρέπει να αφορά την Ευρώπη.
Used to be about 36-37 hospitals in Gaza. Almost all of them are either completely destructive or partially destroyed. There's only one hospital, is European Gaza Hospital at the border between Rafah and Khan Yunis. It's a 250-bed hospital that's still functioning. This European Gaza Hospital, as an example, has about 40,000-50,000 people live in that. So when you go enter the hospital, you see an ocean of people living in plastics, tents, if you will. Not even tents, they're man-made tents from plastics pieces or blankets, if you will. Number two is the water in the hospital. It's not always there. The sewage system is very horrible because remember the whole infrastructure is disrupted. And now we have 50,000 people in the hospital, in the premise inside the hospital using the toilet. So it's overwhelming. It's always flooded, it's always sometimes not working. And then suddenly when you're faced with mass casualty, 10, 20, 30 people coming, the hospital is not capable of managing. So we end up choosing patients who could survive and other ones that could be salvaged in America or Greece, easily salvaged. A lot of supplies are missing to do proper surgeries. We have sometimes to recycle things like a blade, we have to use it many times, just put it in alcohol and use it again. We used to do amputation without anesthetics, C-section without anesthetics, and fertile, perfect environment for infectious disease because, again, people living there.
Absolutely.
And no one is doing wound cleaning, anything. So these people end up having, a lot of them have infection after the procedure, and we lose them after that. We have patients that have maggots growing from their wounds, and no one has changed their wounds for weeks, The majority, they're barely just getting enough water to drink or cook. So a lot of them haven't had a bath or shower for months since October 7th.
Professor, since you mentioned supplies, one question that we have in Greece is whether the humanitarian aid sent from the West is actually reaching the people who need it in Gaza, or lost, midway.
The world responded appropriately. There's only one entry corridor, which is Rafah. When we drive in from Cairo through Sinai to Rafah, there will be, at one point there was like 10 miles or 14 kilometers of trucks, 18-wheelers, waiting on the far side of the highway, waiting to enter. Some of them takes a week, some of them 2 weeks. And until recently, no one can enter them, so have not got any supplies, period. People are starving, and so it becomes more like Hunger Games. And as these trucks are moving, there's no protection for them, so people are jumping on, trying to get the food. So there's a chaos.
Now, there's been talk, even in Greece, whether Hamas is over-exaggerating the numbers of the dead, or whether it is Hamas to be blamed for the aid not reaching people there. How do you respond? Because you've seen pain firsthand in Gaza.
I think it's inaccurate information, absolutely inaccurate information. I've never seen Hamas. They're hiding, buildings and everything. So they're not absent. And I already told you, because of the absence of the governing body, people controlling police, there's the mobs and a lawlessness. So if there's truly Hamas there, no one sees them. No one sees them because 24/7, you have those drones just humming everywhere. And so they really capture images and pictures. So they're not going to walk around with the guns. Now, as for the numbers, actually it's underestimated. When the building gets bombed, completely annihilated, the people that can be retrieved from inside are the ones that make it in the hospital. There's a lot of people still under the rubble and cannot be accessed. People die there and no one can get to them, ambulances or anything. So if anything, the number is way underestimated. That's one, Dimitris. So that's the trauma, okay? And the trauma is very, very small pocket. There's two large pockets that no one is, paying attention to. Is the one is about 350,000 people who have non-communicable chronic disease like hypertension, dialysis, cancer. These diseases that they're getting zero medical attention are dying and they are not counted toward the trauma. So, and on top of that, women who are pregnant are not getting enough attention, dying. Miscarriage up by 300, 400%. Babies are dying when they're born because, some of the babies, they need a, high level of care when they're born. And there's none there. If you come in with a heart attack to the hospital, no one will pay attention to it because the resources are all geared very thin, not enough medication, not in everything toward the trauma.
Can you describe the psychological and emotional state of children, families, the orphans as well you have encountered in Gaza?
Half of the population, for what reason or another, are under 18. And, the constant bombardment, the shelling, the movement, the displacement from 1 to 3 places, seeing relatives disfigured, not able to get food, not able to access water, and the infection. And this is one part we didn't talk about, which is the third largest bucket, is the infection. Infection is about 1.1 million people now is infected with either upper respiratory infection, gastritis, hepatitis A, maybe cholera, we don't know for sure. But so that's another pocket that people are getting affected and hurt by. 5-year-old have no family members left, all dead, and all he could tell me is, I wish I could die. That terminology should never be in a kid's head at the age of 5. They shouldn't even know that word. So the psychological stress, depression, some kids are just become aphasic, meaning they don't talk, they're just sitting there. There's some are still playing and resilient. Kids, for the most part, are resilient. But the majority are just in despair. I give you an example. This family moved 2 times. So they ended up in the middle of close to Khan Yunis. And then the flyers came in and dropped by the Israelis for people to move. But the family decided, we moved 2-3 times, we're not going to move. So in the middle of the night, the soldiers came in and thought there's someone in the family, killed the father, and then killed the mom. And it's dark, there's no lights and anything. And you have a 10-year-old girl, 6-year-old girl, and 1.5-year-old boy. And this 10-year-old becoming the wise, elderly person taking care of the rest of the kid. She wants to cry, but she can't because she wants to, console her 6-year-old and how 1 year. So imagine just the psychological stress. This 10-year-old suddenly became a mom, take care of these people. But there's about 17,000 kids that have no family around. So there's 50,000 women are pregnant, they're not getting, adequate prenatal care. If the baby is malpositioned or preach or anything, no one is going to deliver safely. So there's a lot of people dying from that.
Do you think that this situation, which is been going on for a while now, actually fits the terminology of a genocide in progress? Is it a massacre?
Here in the United States, we have to be careful with this terminology.
Yeah, absolutely.
Yeah. But, I think there is an international court of justice. They're looking at the evidence, and, they took the case So there's some merit to it. Otherwise, they would turn it down. The judgment will come, you know.
What do you think would be the most feasible thing to request, to ask for from our government, for example?
There is aid. You need a period of time to get in and distribute it well and address all these problems.
Is there anything that you would like to address to the Greek public opinion?
Most of Gazans have nothing to do with Hamas. They're human beings. They love the Greek people. They want to live in dignity and respect. They want to have access to safety, home, food. They want their kids to go to school, dress nice, play. They're not numbers. They're human beings. They have names. They have aspirations. They have stories. They have nothing again with what happened. They condemn what happened. Don't get involved in, is these numbers correct or not correct? You know, this is splitting hair. Is it Hamas, not Hamas? Forget Hamas. It's Hamas and the Israelis are together. Israel IDF fighting. But think of the people. There are too many casualties, innocent casualties.
Thank you very much, Professor. Thank you very much, David, for having this conversation with you today, which is enlightening for the Greek. Thank you.